Good morning, everyone. Did you know that of the approximate 3.6 million American women that are pregnant every year, 1/3 are smokers? Well, that means that over 1 million babies are born each year to women who smoke. What are the effects on these infants? ABC's co-host of Good Morning America, Joan Lunden, joins us live from New York to discuss smoking during pregnancy. Joan herself is the mother of a 2.5-year-old daughter and is expecting her second child this month. And she has recently been named chairman of the American Lung Association's new Smoking and Pregnancy Program. Good morning, Joan.
Good morning, Eileen.
It's nice that you could join us. Let's get right into the effects that smoking has on pregnancy. What can happen to the baby?
Well, the things that can happen to a baby besides a significantly increased possibility of miscarriage are also stillbirths, low birth weight, which brings with it many, many problems when the lungs are not developed in a young infant, respiratory distress syndrome. There are a number of birth defects associated with this. And now we're even learning that the children of smoking women tend to be smaller, shorter. They get to be 6, 7 years old, and we find that they have lower math and reading skills. And therefore, I should really explain, too, though, why this is happening. There are about 2,000 compounds in smoke, but the three that you really have to worry about are nicotine and carbon monoxide and benzopyrene. Nicotine constricts your blood vessels. Little babies need a lot of oxygen. This is cutting off the oxygen and the food supply to the baby. And carbon monoxide, of course, is a poisonous gas, and we know that all three of these things do cross the placental barrier. But it also gets into your bloodstream, and it also can reduce the amount of oxygen going to the baby. We used to think the placental barrier kept everything out. Of course, the thalidomide crises let us know different.
Well, you're right. That was the perception. What has research done to change that perception?
It came with the thalidomide crisis that they really started realizing. You know, we've known for 100 years that there were harmful effects on smoking women. About 100 years ago, they started realizing that in tobacco factories, women who were working in these factories were starting to have more miscarriages. In about the 1930s, we started some really good studies, and since the 1950s, we've had much of this information. The problem seems to be getting the information out to the women, because Roper did a study in 1980 and found that almost half the women studied had no idea that there were dangers associated with smoking, and they certainly couldn't tell you what any of the actual results could be.
All right, then specifically, if all of these gases get through the placental barrier, then the fetus or the baby actually is affected directly by these.
That's right. If you smoke 2 packs of cigarettes a day, you are cutting off a good 25% of the oxygen to the baby. This can cause asphyxiation. This can cause problems in the first 3 months with birth defects. See, the trouble is many women don't know that they're pregnant until they're maybe 2 months pregnant. If you really want to have a healthy, safe pregnancy and you are a smoker, you should stop smoking before you start trying to get pregnant.
All right, but that's easier said than done,
That's
Joan.
right.
What if you just can't quit?
All right. For one thing, the more you cut down, the better. If you can quit smoking by your 4th month, at least then you will have the same chances of having a normal birth weight baby as a woman who doesn't smoke. And that is a very, very increased result, because low birth weight brings with it many, many other complications. If you can't quit, you can at least try to cut down, because the more you cut down, the more oxygen the baby will get. And at least when you're getting ready to deliver, 24 hours in advance at least, possibly 36 or 48 hours in advance, if you can stop smoking, you'll at least allow more oxygen to get to the baby during the birth, and that's one of the really crucial periods.
Talk about the father's role when it comes to smoking. Is it important that the father quit as well?
Well, there's a lot of controversy still, a lot of conflicting reports as far as the effects of secondhand smoke on anyone besides a pregnant woman. However, we do, of course, know that it is not easy. It's easy for us to sit here and talk about quitting smoking, but it's not always that easy for people to do it. If a husband is also smoking, obviously they can help the pregnant woman much by stopping with them. But besides that, when the infant is born, we're not just talking about during the time of pregnancy. When the infant is born, you then have a problem of smoke around the newborn.
Sure.
For one thing, the woman smoking, if she starts smoking right away again and she's breastfeeding, everything goes right into her breast milk. Besides that, nobody should be smoking around a newborn infant, and that includes friends that come over. Don't allow them to smoke. You cause respiratory problems, all kinds of asthmatic problems, allergies. All of this can be increased, and you can have a lot of problems just because people are smoking in the room.
How, even in other rooms of the house, though, the smoke tends to filter
That's
through
right.
the whole home, doesn't
Yeah.
it? How about quick tips on giving it up? Can you give us any of those?
The best tip, really, I would say, is that if you're serious, if you can do it on your own, great. But if you need some help, the American Lung Association has local chapters all across the country. They can call, people there in Boston can call the American Lung Association. They have self-help kits if you prefer to do it that way. If you can't do it on your own, they have many, many groups that you can join, and they'll give you all the help in the world to stop smoking. And I can't think of a better incentive, Eileen, than to give your little baby the best gift that you'll ever give it in its entire life, which is a healthy, safe start.
Absolutely. Well, Joan, we wish that for you, for your second child, and we know you've had a busy morning, and we thank you for taking your time to join us.
Thanks, Eileen.
Great work that you're doing. Joan Lunden.